Clinical presentation of an osteochondritis dissecans may vary a lot, depending upon what is the stage of the disease. But usually, the most commonly, these are children who come with symptoms mainly after increased physical activity. And parents, the first and foremost complaint is whenever he or she is actually playing, after that the problem starts. And it's a bit of a chronic stage as well, in which the symptoms have been going on for quite a few months now. And off and on, there's a problem with the knee joint if it's involving the osteochondritis dissecans of the knee. The most common symptoms usually is actually the pain. Especially they complain that after the activity, or for example any sports activity, the patient complains of a lot of pain in the knee joint, and pain may be severe enough for the patient not to actually bear weight on that knee joint. So but once patient takes few rest and takes off certain maneuvers, it eventually the pain goes away and patient is able to continue the activity in the next very day. Therefore, it's still dull aching kind of a pain, but it may get aggravated, especially after any activity which is being performed, especially the sports activity. The next pain is usually activity related pain that is vague and poorly localized. Why? Because whenever these children are actually playing, there is micro trauma which is actually occurring in the knee joint. You cannot actually pinpoint, or they do not actually tell you exactly where is the pain. This involves whole of the knee. This may involve certain part of the knee, and as usually it's the medial femoral condyle, the main problem lies towards the medial side of the knee joint, or over the medial joint line, medial femoral condyle. This area may be very much tender and may be problematic as well. And sometimes it can be localized usually, but most of the time it's not localized, and they complain of having a generalized kind of a knee pain which is vague, dull aching, and actually goes away as well without really doing a lot of things. That is why the reason is that it gets prolonged, because it's not severe enough to actually warrant straight away going to a doctor. So once it goes away, the patient says that probably whatever it was, it's gone now, and he or she is actually fine, and they continue playing their game day in, day out. And eventually, once a few months, a whole season has passed, then the problems become severe enough for the patients to actually come to the clinic and get themselves checked up for this problem. Then sometimes it becomes mechanical symptoms, depending upon at which stage of the disease is. If it's involving there is only cartilage separation and osteochondral fragment is present but it's undisplaced, probably there will be no mechanical symptoms. Mechanical symptoms usually present late, and when they present, that means probably this fragment has actually detached and also gone into the joint as well. So once it's in the joint, it may act as a loose body, and once it may cause these kind of symptoms like locking, catching, during certain flexion extension of the knee, the pain may become severe and patient may not be able to completely extend or flex the knee joints. These sort of symptoms start to occur, but that is usually at the very end. The first and foremost and most common symptoms which is initially present is, it's not the pain, it's not the swelling, but it's always the effusion which is present around the knee joint. Recurrent effusions of the knee is very common, and this may initially be the only symptom which is seen in the patient. For example, when they say that it's been happening for 6 to 8 months, but first it used to only swell up after the game and it used to settle down in the morning, and then I used to go back to playing again. But now with the swelling, there's some degree of pain as well, and now it has started to sort of locking and catching a mechanical symptoms start to appear as well. So there is a kind of a steady progression of the symptoms which present with, and as the disease progresses, symptoms become more severe and may become more problematic for the patients. So when we are talking about the symptoms of the osteochondritis dissecans, first and foremost is the recurrent effusions. This may eventually progress to slight pain which may not be localized. which may eventually get localized. But last but not the least is actually the mechanical symptoms. And once the mechanical symptoms starts to appear, this means the disease has actually progressed quite a lot.